Welcome to today's deep dive. We're jumping straight into a massive, honestly, paradigm-shifting movement happening right now in regenerative medicine.
Yeah, it's a completely fascinating shift.
It really is, and we're pulling from a huge stack of sources we've gathered for you today. We're looking at, medical clinic protocols, some really detailed clinical case studies, and the latest British Menopause Society guidelines.
All to explore this treatment known as polynucleotides.
Right. And specifically, we are zeroing in on a highly requested focus for you today, which is our intimate polynucleotides hormone-free.
And to answer that, we really have to look at the intersection of, well, aesthetic pharmacology and gynecology.
Yeah.
Because we are looking at a completely new biochemical pathway here for patients who are suffering from mucosal tissue degradation. And it's a pathway that basically bypasses the endocrine system entirely.
Okay, let's unpack this, because before we can even talk about how this technology behaves
Yeah.
in the vulvovaginal area, we need to establish what a polynucleotide actually is at a cellular level.
Right, the basics.
Exactly. And why on earth the medical field is sourcing it from fish DNA. Because when you read the literature, you immediately hit this fact that these injectables are derived from highly purified gonadal tissue.
Which is, yeah, the sperm cells.
Right. The sperm cells of salmon or trout.
The sourcing always catches people off guard. I mean, it sounds a bit wild,
Absolutely.
but the pharmacology actually relies on it. In regenerative medicine, we need these macromolecules that can trigger a biological response, but, and this is key, without triggering an immune response.
Right. You don't want the body fighting it.
Exactly. And salmonid DNA is remarkably similar in its base structure to human DNA. So the manufacturing process uses this thing called high purification technology, or PN-HPT.
PN-HPT. Got it.
Yeah. They extract the DNA fractions and basically put them through such an aggressive purification and sterilization process that every single trace of protein, lipid, and, potential allergen is just completely stripped away.
I have to challenge that premise, though, just a little bit.
Go for it.
Because if you're listening to this and you understand how the human immune system works, you'd think that injecting foreign DNA fragments would trigger an immediate inflammatory response.
It's a logical assumption, yeah.
Right. And furthermore, if you purify something so intensely that it's essentially just like bare biological code, how does the body even recognize it to do anything? Why doesn't your lymphatic system just immediately clear it out as cellular waste?
Well, that comes down to the specific molecular weight and the receptor interactions.
Yeah.
These aren't just, random bits of debris floating around.
Okay.
They are highly specific polymers. So once they're injected into the extracellular matrix, these polynucleotide chains don't get fleshed out immediately because they undergo a really slow enzymatic degradation.
So they stick around a bit.
Right. And as they break down, they release nucleotides and nucleosides. And here is the critical mechanism these molecules specifically bind to the A2A purinergic receptors on the surface of your own fibroblast cells.
Oh, wow. So they are essentially chemical messengers.
Yes, exactly.
I mean, they aren't acting as a physical filler to just plump up the skin like traditional dermal fillers, right? They're actually docking onto the cells and sending a signal.
What's fascinating here is that the signal they send completely alters the cell's behavior.
How so?
Well, when those A2A receptors are activated, it triggers this intracellular cascade. It essentially forces the fibroblast, which, might be sluggish or totally dormant due to aging, to ramp up the secretion of type 1 collagen, elastin, and fibronectin.
Oh, so it wakes them up.
Exactly. And it also has a potent anti-inflammatory effect because it reduces the secretion of pro-inflammatory cytokines.
Okay, so to use like a tech analogy for you listening, if traditional dermal fillers, hyaluronic acid, or like using spackle to quickly fill a crack in a wall.
I like that.
Yeah, then polynucleotides are like hiring a contractor to rebuild the wall's actual foundation. It's not like adding a new hard drive for more storage. It's like pushing a firmware update that optimizes the hardware you already have.
That is a perfect way to describe it. It tells your body to run its repair protocols at maximum efficiency.
Although it is worth noting for you listening, because this relies on an animal-derived source to get those highly specific molecular weights, these treatments are not suitable for vegans or vegetarians.
Right. That is an important caveat. But that natural derivation provides a complexity in the DNA chain that we just currently struggle to synthesize effectively in a lab at scale.
Not for this specific regenerative purpose, anyway.
Right. And the result is this highly biocompatible biostimulator that literally rebuilds the foundational architecture of the tissue from the inside out.
Which brings us to the core of our focus today.
Yes, the intimate application.
Exactly. If we have this biostimulator that can force dormant cells to rebuild structural integrity, it makes perfect biological sense to apply it beyond facial aesthetics. We are moving from, the under eye and the neck to the vulvovaginal area.
It's a massive shift.
And the reason this is such a critical evolution is because of a condition known as genitourinary syndrome of menopause, or GSM.
GSM, yeah. And GSM encompasses all those physiological and anatomical changes that occur as systemic estrogen levels just plummet during perimenopause and menopause.
It's devastating for a lot of women.
It really is, because the vulvovaginal tissue is incredibly rich in estrogen receptors. So when that hormone is suddenly withdrawn, the entire microenvironment basically collapses.
Right.
The mucosal lining becomes thin, fragile, and loses its elasticity. It's a condition called vaginal atrophy.
And the downstream effects of that atrophy are severe. I mean, the sources note that as the tissue thins, the glycogen levels drop.
Yes, which starves the good lactobacilli bacteria.
Exactly, which then means the vaginal pH rises.
Yeah.
And that leads to this awful cascade of chronic dryness, irritation, recurrent urinary tract infections, and dyspareunia.
Which is severe pain during intercourse.
Right. Now, when you consult the British Menopause Society guidelines, the traditional, gold standard treatment for GSM is highly effective, but it relies on replacing what was lost.
Right, localized hormonal therapy.
Yeah. This typically involves topical vaginal estrogens in very low doses. So we're talking about pessaries like Vagifem or creams like Ovastin.
And the sources also detail an alternative hormonal route using DHEA, commonly known by the brand name Intrarosa.
Yeah, Intrarosa.
Yeah.
And the mechanism there is completely different from a standard estrogen cream, isn't it?
It is. Intrarosa is a fascinating bridge. It utilizes a process called intrachronology. So the pessary contains prasterone, which is a synthetic version of DHEA.
Okay.
When you insert it into the vagina, the epithelial cells take up that DHEA. Inside the cell, and this is the key, it happens entirely intracellularly, enzymes convert the DHEA into active estrogens and androgens.
Oh, wow. So it's very localized.
Very. The cell uses what it needs to regenerate, and then inactivates the hormones before they can, significantly spill over into the systemic bloodstream.
It's like a closed circuit factory.
Yeah.
The hormones are manufactured and consumed entirely on site. But this highlights a massive roadblock in gynecology. Because even with localized estrogen or intracrine DHEA therapies, you have a distinct population of patients who absolutely cannot use them.
Right, the oncology patients, for instance.
Yes. If a patient is on aromatase inhibitors following an estrogen receptor-positive breast cancer diagnosis, their oncologist is likely going to veto any treatment that introduces estrogen to the body.
No matter how localized it is.
Exactly. Plus, many patients just simply prefer to avoid hormone therapy entirely. It's a personal choice.
And that patient population has historically been left with very few medical-grade options to treat the root cause of their tissue degradation. They were essentially just told to, manage the pain and not repair the damage.
Which is incredibly frustrating. And this allows us to definitively answer the core question of today's deep dive. Are intimate polynucleotides hormone-free?
The answer is an unequivocal yes.
100% hormone-free.
Yes. They stimulate tissue regeneration via those A2A purinergic receptors we discussed earlier, completely bypassing the estrogen receptors.
And the clinical application of this is just revolutionary. We are seeing the introduction of specific protocols formulated for the mucosal environment, like the Nguyen treatment.
Nguyen is a great example. It takes the regenerative signaling of polynucleotides and combines it with two other critical components to stabilize the tissue.
Let's look at that formulation, because the structural demands of the vaginal mucosa are entirely different from the skin on your face.
Oh, absolutely.
So Nguyen utilizes the purified fish DNA, but it also integrates non-cross-linked hyaluronic acid and mannitol. I want to break down non-cross-linked first, because when people hear hyaluronic acid, they usually think of, those stiff dermal fillers used to build cheekbones.
Right, and those traditional fillers are cross-linked.
Okay, what does that mean?
The hyaluronic acid molecules are chemically bound together to form a dense, stable gel that resists breaking down and holds its shape. Think of it like the rigid springs inside a mattress.
Okay, makes sense.
But in the vaginal mucosa, you obviously don't want a rigid lump.
No, definitely not.
So non-cross-linked hyaluronic acid flows freely. It acts, sort of like a fluid mesh, integrating smoothly into the tissue to bind water molecules and provide immediate, profound hydration without creating any artificial volume.
But the problem with non-cross-linked hyaluronic acid, biologically speaking, is that the human body produces an enzyme called hyaluronidase.
Yes, which aggressively breaks it down.
Right. So if you just inject non-cross-linked HA, it just vanishes in a matter of days, doesn't it?
It does, which is precisely why the mannitol is included in the formula.
Ah, okay. Mannitol is a sugar alcohol, right?
It is, but in this context, it functions as a potent antioxidant and a free radical scavenger.
Oh, interesting.
Yeah, it neutralizes the oxidative stress in the inflamed tissue and physically protects the hyaluronic acid molecules from rapid enzymatic degradation. So it significantly extends the half-life of the hydration.
So you have this triple action synergy going on. The mannitol guards the environment, the non-cross-linked HA floods the extracellular matrix with moisture, and the polynucleotides bind to the fibroblasts to order the synthesis of new collagen and elastin.
This raises an important question, though.
Yeah.
How effective is this biochemical cocktail in a real-world worst-case scenario?
Right. Does it actually work when things are really bad?
Exactly. And we can look at a highly detailed clinical case report published in the International Journal of Women's Health for that. They documented the treatment of a 42-year-old woman suffering from severe iatrogenic menopause.
Iatrogenic meaning medically induced. And her specific medical history makes this, honestly, the perfect stress test for polynucleotides.
It really does.
Because she had undergone aggressive chemoradiotherapy for anal squamous cell carcinoma.
And pelvic radiation is just devastating to the local tissue. It causes a condition called radiation endarteritis, where the micro blood vessels in the area literally close off and die. The tissue becomes fibrotic, snarved blood flow, and profoundly rigid. For this 42-year-old patient, the treatment eradicated her cancer, thankfully, but it completely destroyed her vaginal mucosa.
Leading to severe dyspareunia and sexual dysfunction.
Exactly.
Now, traditional hormone therapy would struggle to repair radiation fibrosis to that degree anyway.
Right.
And given our oncological history, the medical team opted for this regenerative, hormone-free route.
They did.
The protocol involved a series of 6 sessions of intradermal and submucosal injections of the polynucleotide and hyaluronic acid blend spaced over about 4 months.
And the histological and symptomatic evolution was just remarkable.
What happened?
Well, because the polynucleotides stimulate angiogenesis, which is the formation of new microscopic blood vessels alongside the collagen production, the tissue actually began to revascularize.
That's incredible.
The clinical report noted spontaneous correction of the vulvar dehydration. She experienced deep structural regeneration of the submucosal extracellular matrix.
So it actually rebuilt the tissue.
Yes. Her dyspareunia resolved, completely restoring her sexual well-being, utilizing a completely non-hormonal biological signal.
Here's where it gets really interesting, though. Because once you prove that a treatment can regenerate devascularized post-radiation tissue, the broader clinical applications just become obvious.
Oh, absolutely.
The sources outline these intimate confidence protocols where clinics are utilizing polynucleotides far beyond just menopausal atrophy.
Yeah, we are seeing it utilized heavily in postpartum recovery.
Really, postpartum.
Yes. Because during childbirth, the pelvic floor and vaginal mucosa undergo extreme mechanical stretching and microtrauma.
Right.
And even after the superficial tears heal, the tissue can remain lax or structurally compromised. Polynucleotides essentially accelerate the cellular repair of that overstretched matrix.
That makes total sense. And the literature also points to a reduction in recurrent urinary tract infections. Because if you rebuild the thickness and the structural integrity of the mucosal wall, you are physically reinforcing the barrier against bacterial pathogens.
Right. It's a structural defense mechanism rather than just, prescribing endless rounds of antibiotics.
Which is huge. And the psychological relief tied to that structural repair is immense. But I think to truly understand the value of this treatment, we really have to look at how it fits into the current landscape of non-hormonal intimate care. Because it is not the only tool available out there.
No, it's definitely not.
Let's do that comparison. If we map out the spectrum of non-hormonal treatments, the most accessible foundational layer consists of over-the-counter vaginal moisturizers and lubricants.
Right, and the British Menopause Society highly recommends brands like Yeses or Silk.
Yeah.
And those are excellent products, but their mechanism of action is entirely superficial. They are bioadhesive polymers.
Meaning they just sit on the surface?
Basically, they stick to the epithelial cells and hold on to water, temporarily shifting the pH to a healthier, more acidic level. However, they do not communicate with the fibroblasts.
Okay, so they offered necessary symptom management. Okay, so if we jump to the completely opposite end of the non-hormonal spectrum, we find energy-based devices. And these have gained massive popularity. We're talking about fractional CO2 lasers like the Mona Lisa Touch or radio frequency platforms like Empower RF.
And energy-based devices operate on the principle of controlled trauma.
Right.
A laser ablates the tissue, creating microscopic thermal injuries. The body detects this heat damage and initiates an emergency wound healing cascade.
So it rushes blood to the area.
Right, it releases heat shock proteins and stimulates neocollagenesis to repair the burn.
The pushback there is obvious, though. I mean, you are intentionally burning already fragile, atrophied tissue to shock it into behaving.
It sounds counterintuitive when you put it like that.
Well, furthermore, I'd argue that a laser treatment assumes your fibroblasts are healthy enough to mount a robust wound healing response in the first place.
That's a very good point.
Because if a patient is severely menopausal and their cellular machinery is just exhausted, creating a thermal injury might just result in fibrosis or scarring rather than supple new tissue.
And that is a critical clinical consideration. Lasers require functional host cells to do the heavy lifting post-injury. Furthermore, they involve downtime, potential discomfort, and are actually contraindicated for certain autoimmune or inflammatory conditions.
Okay, then there is PRP, platelet-rich plasma therapy, which is commonly marketed in this space as the O-shot.
Right. PRP utilizes your body's own growth factors. Blood is drawn, centrifuged to concentrate the platelets, and then re-injected into the clitoral and vaginal tissue.
Got it.
The alpha granules in the platelets release a flood of growth factors to stimulate nerve sensitivity and tissue repair.
But the flaw with PRP is the variability, right? Because you are harvesting the biological material from the patient at that exact moment in time.
Yes.
So if the patient is, say, 65, systemically inflamed and suffering from severe estrogen depletion, the plasma you draw is going to reflect that environment. You're injecting exhausted growth factors back into an exhausted area.
That is exactly the issue. PRP is autologous, meaning it comes from you, which makes its efficacy highly dependent on your age, systemic health, and current cellular vitality.
So what does this all mean? When we place intimate polynucleotides into this landscape, they really occupy a highly specific, revolutionary niche.
They do.
They provide the deep cellular regeneration that over-the-counter moisturizers just cannot achieve. They do it without inflicting the thermal trauma and require downtime of a CO2 laser.
Right.
And unlike PRP, they deliver a standardized, highly concentrated dose of external DNA signaling that doesn't rely on the potentially compromised quality of the patient's own blood.
They delivered an exogenous, consistent biological blueprint directly to the A2A receptors, literally forcing the tissue to rebuild itself, regardless of the patient's endogenous hormone levels or systemic inflammation.
We have covered some incredibly dense pharmacology today.
We really have.
We started by breaking down the science of polynucleotides, exploring how highly purified marine DNA fragments utilize purinergic receptors to fundamentally alter the behavior of sluggish fibroblast cells.
And we mapped the devastating effects of genitourinary syndrome of menopause. We established why the traditional gold standards of localized estrogens and intracrine DHEA therapies leave a critical gap for patients who cannot or simply will not utilize hormones.
And we definitively answered the core question driving this deep dive. Intimate polynucleotide protocols are 100% hormone-free.
Absolutely.
We saw through a rigorous clinical case study how this triple-action formula of DNA, non-cross-linked hyaluronic acid, and mannitol can revascularize and regenerate even severe radiation-damaged tissue, offering a highly controlled alternative to lasers and PRP.
It represents a structural shift in gynecological aesthetics. We are no longer just lubricating symptoms or burning tissue to force a response. We are speaking directly to the cell's internal repair mechanisms.
It is a profound leap forward for women's health. And we want to leave you with a final thought to ponder as we wrap up this deep dive.
Okay.
If we've successfully managed to extract the highly complex structural code of DNA from marine life, purify it, and use it as a completely hormone-free master key to unlock human cellular regeneration, what other natural biological codes might be hidden in the ecosystems around us, just waiting to be discovered to teach the human body how to heal itself?